So this is a short video showing you how to insert the Passy-Muir valve for, first of all, a patient who is not on ventilation. Then next I'll show you how to do it in line with the ventilator tubing. So our patient has a size 6 tracheostomy. One of the first things that we would just check is the size of the trache and if there's any airway issues before assessing for cuff deflation. What we're going to do next is just do a deep suction down the trache, and we could also just do some yanker suction to make sure that there's no secretions above the cuff that the patient might aspirate when we deflate the cuff, and that the chest is clear. Next, we're going to aspirate the subglottic port. If your tracheostomy has one of these, if you've got a trache that doesn't have a subglottic port, you would just need to do a simultaneous suction. So if you've got somebody else there to do the suction as you deflated the cuff. But in this trache, we have the subglottic port. We're just going to use a clean 10mm syringe onto this port here and just withdraw to remove any secretions that might be sitting above the cuff. So once we're happy that the aspirates have been removed, we can go on to remove the air from the cuff. We need to do this nice and slowly so that the patient doesn't get a shock as lots of air starts to rush past their trache, especially if they're new to this and you're assessing it for the first time. It's going to be a bit of a strange sensation. So another clean 10mm syringe onto the end of our cuff and just slowly withdrawing the air. At this point, you might start to hear some gurgling, some upper airway noises. Your patient might even start to produce some voice. They might cough as they get more stimulation in their airway. So you might just need to have your yanker suction handy again. So once we've got all of the air removed, we're just going to assess how they cope with that for a couple of minutes before we go on to put the valve in. So we just want to watch they're monitored, watch their heart rate and their SATs. I would have a SATs probe on them if they're not constantly monitored, and just watch them, check that they're managing okay. So next we're going to put our Passy-Muir valve on. So it's simple when they're on a trache mask like this. We're not going in line with any tubing, so we just need to place the valve onto the end of the tracheostomy, and it will only go one way. So at this point, hopefully, our patient will have some voice, and we can just spend five minutes or so on the first attempt, just assessing how they tolerate that. Then when we're ready to take that off, we take the valve off, and then we'll be re-inflating the cuff. So same amount of air that you've removed from your cuff into your syringe, and just push that back in. You can then get a manometer to place on the end of your cuff and just check that you've got the right pressure. So next I'm going to show you how to insert the Passy-Muir valve for a patient who is ventilated with their trache. So there's a little bit more to consider here. As before, we will just do some yanker suction into the patient's mouth to make sure we've got no oral secretions that might drop down. We may want to do a deep suction first, so we can just use our inline suction to do that. Again, if you've not got a subglottic port, you would need to do simultaneous suction. Like we did with the self-ventilation patient, we're going to aspirate the subglottic port. Same again, just withdrawing on our 10mm syringe. And as previously, you might get some coughing as you do that. Next, we're going to deflate our cuff. And again, here we'll be listening out for any upper airway sounds. We're just going to go nice and slowly. Fully deflate the cuff. So we might find at this point that the ventilator starts to alarm because we're going to get some more leakage, which our cuff would have been preventing. So we can use that to check that the patient is actually getting some airflow past the trachea. So really the ventilator alarming for that reason is a good thing that gives us some positive information that there is enough airspace around the trachea. We're also just watching how our patient tolerates that cuff deflation. Like I said, they might be coughing a bit more, so you might need to do some suction or some Yankee suction to clear any secretions. So tolerating that well, we'll place the Passy-Muir valve in line. So we've got our valve like before. We also need this extra piece of tubing to connect it into the circuit. So which attaches onto our Passy-Muir valve. So that will just attach on that way, and this is going to go in line in the ventilator tubing closest to the patient. So we'll just attach here, place that in line there. Okay, and hopefully at this point our patient will have a voice. So we can assess how they tolerate that over the next few minutes, see whether they can speak to us, observe them. Okay, so now our patient has had enough of the Passy-Muir valve. We're going to remove it. We're just going to do the reverse. We're going to take it out of the tubing and just reconnect. And now we want to re-inflate our cuff. So we're just using the same amount of air that we took out to just re-inflate the cuff. And again, get our manometer once we've done this to just check that we have left the cuff at the right pressure. And then we're all done.